Hello, everybody. Good afternoon, and welcome once again to our weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Vigili, Hispanic Public Information Officer for Montgomery County Government, and joining us today is Dr. Earl Strider, our Assistant Chief Administrative Officer, as well as Sean O'Donnell, Program Administrator, Public Health Emergency Preparedness and Response for the Department of Health and Human Services. Reporters, all of you should have permission to record. If you do not, please use the chat and use the chat again for the Q&A portion of this presentation. We do have a hard stop at 1:30 this afternoon, so let's get started. Mr. County Executive, good afternoon.
Good afternoon. Thank you all for joining us for our weekly press briefing. I'll start first with the case rate information. As of our COVID update this week, our test positivity rate is 1.65%. We have a case rate of 8.28 cases per 100,000 residents. We had 76 cases yesterday, required 4 hospitalizations, and there was 1 death. And as you can see from the graph from the CDC, we've seen a 15% increase in cases over the past week, and our numbers are heading in the wrong direction. Over the last month, we saw a dip in case rates, but now we're back to about where we were a month ago. Yesterday was 7 days in a row of substantial transmission, triggering the county council's regulations to reinstate indoor mask mandates starting this Saturday, 12:01 Saturday morning, meaning that wearing masks will be required in all indoor public facilities in the county. Nationally, cases are increasing the most in northern and the mountain states of our country, which makes sense as weather has gotten colder there earlier and sooner than here. Vermont has a case rate of 57 per 100,000 residents, even with 72% of their residents being vaccinated. Our neighbors in Pennsylvania have a 400% case rate, higher case rate than Maryland's, and West Virginia's case rate is 40 per 100,000 residents, with only 41.2% of their population vaccinated. Vermont's case rates being high, what they've been able to show is that the people going to the hospitals and getting the sickest continue to be those people who are not vaccinated. I expect as our weather continues to chill, more activities will move inside. We're likely to remain in substantial transmission category for a while, unless we see a sudden increase in vaccinations regionally, statewide, and around our country. We continue to be a highly mobile place. Residents continue to travel, use the airports, travel abroad, travel within the country. So we're not immune and we're not an island. And I would expect that, we'll probably continue about where we are now for a while. Let me be clear, everyone should be wearing a mask when indoor or in a crowded setting, no matter what the official regulations are. I know that beyond the small minority of our residents, most people get it. They wear their mask, and that is why we continue to be one of the safest jurisdictions in the nation in terms of our COVID rates. As families gather for Thanksgiving holiday next week, many will have dinners and festivities with more people than last year. This means that exposure to COVID, and especially the Delta variant, will likely increase. And we are in a different place than we were this time last year, which is a good thing. So many more of us are vaccinated, including our children, and we're looking forward to seeing many family members and friends that we didn't see last year. So we have this handy dandy recipe for Thanksgiving, a little non-traditional recipe. It talks about getting vaccinated, wearing a mask when you're grocery shopping or in other public indoor spaces, when serving food, washing your hands before eating or serving food. Outdoors is safer than indoors, so to the extent we can do things outdoors, that would be a preference. Communicate in advance with guests about your COVID-19 ground rules and the precautions you're taking. Cancel plans if you're sick, and please stay away from others if you're sick. And have safe travels. If you're not fully vaccinated, it might be wise to delay travel plans unless you know you're going to be only around other vaccinated people. If you're traveling with unvaccinated family members, such as children who are not yet eligible to be vaccinated, take additional precautions. Avoid crowds, wear a mask, and get tested before and after your trip. We have to realize we're dealing with a different and much more aggressive variant than we were at this time last year. So as you make your final plans and preparations for Thanksgiving, please keep in mind that this pandemic is not over. Encourage all your guests to be vaccinated and to get their boosters. Consider eating outside if the weather cooperates, and cancel plans again if you're feeling ill, and stay away from others. Being safe and smart with COVID during Thanksgiving will help us all avoid our December holiday gatherings being interrupted by illnesses. As far as our progress with vaccinations this week, we're at 78.2% of our total population fully vaccinated and 87.7% with at least one dose. There's been a sharp increase in our percentage of one dose residents due to the pediatric vaccination efforts over the last 3 weeks and due to our over the last 3 weeks. This is a snapshot of vaccinations in the county. As you can see, we continue to maintain a fairly high rate of vaccination. The senior population continues to be the leaders in being vaccinated. We continue to lead the state in the number of pediatric vaccinations. You can see this from the chart below. Just important to me, we're prioritizing equity and targeting lower income, minority, and immigrant communities to ensure that this vaccine is being distributed fairly. We've vaccinated about 20,000 children since the beginning of eligibility for this group. We are only 1/6 of the state's total population, but we have a way disproportionate share of the pediatric vaccines that have been distributed in the state. I will say that the county alone has a responsibility for making sure there's equity in our vaccinations. What more data shows is that there are still disparities within the community. And while the county focuses on making sure that everybody can get access to vaccines, what happens in hospitals and clinics and doctors' offices and pharmacies isn't guided by any of the same principles that we've used in trying to put the vaccinations out. And we continue to run clinics in schools. We began vaccinating this age group 3 weeks ago tomorrow. And as you can see from this chart, 61% of pediatric vaccinations are being conducted by our own Health and Human Services Department and our MCPS and community partners. Only 22% is coming from physicians, 13% from pharmacies and grocery stores, and the remaining 4% from hospitals and nonprofits. And just to be done throughout this process, we've made equity a priority. In our first weekend, we held 12 clinics at MCPS locations chosen because they were Title I schools and because they were convenient to large groups of students. And as of yesterday, county operated clinics had vaccinated 11,146 in the total for this age group. But I'm concerned that our vaccine supply that's coming to the County Health and Human Services Department has actually gone down. We only received 7,000 doses on Friday, the 12th. But the Maryland Health Department has indicated that we might not get any this week or next week, because we need to ensure that we have doses to cover second shots for everyone who was vaccinated in the first several days of the clinics. We canceled planned clinics that we were sponsoring with MCPS last weekend. I hope the state notices this discrepancy and increases the supply to the county government. There are a lot of doses sitting in freezers, not ours, around the county that are just sitting there and could be put out. And if the state would move those doses from places where they're not being used to us, where we can actually use them, it would be an enormous help in speeding the rate of vaccination in the county. But as it's been from the beginning, the only vaccinations that the county controls are the vaccinations it gives out. All the other doses that are given to the county that go to the private clinics, the doctors, the pharmacies, anybody but us, how they distribute their vaccine, where they distribute it, when they distribute it, is solely determined by them. We are driven by a policy of making sure we get the vaccines out as quickly as possible. If you have any trouble getting an appointment with our HHS department, please check with your pediatrician or local pharmacy for an appointment. I'm concerned that the doses going to the private sector partners aren't being delivered. And so you know that if you hit one of our sites and we're not able to give doses, you should check your local pharmacy to see if you can get a dose there. We're doing good work so far, but we can do better on this front, and hopefully the state will assist us. I know last week we had an issue with the correct amount of dosage that was given to recipients at South Lake Elementary School. One of our HHS staff recognized that students were being underdosed and immediately notified supervisors of the mistake. So mitigation measures were instantly enacted. I want to note that the incredible work of this employee to catch this discrepancy, and thank them for doing that. Dr. Crowell, Dr. Bridgers, and HHS staff met with parents of the school yesterday and are meeting with them again today. They're providing these parents with information, the science, and answering questions they have. Mistakes happen. It happened here now, obviously. It's happened in other places. But I appreciate the courage and professionalism to act and correct this quickly and to own the fact that a mistake was made. I appreciate the work that staff is doing. Finally, this weekend is the annual Thanksgiving parade in downtown Silver Spring. This is the only Thanksgiving Day parade in the Metro DC area and signals the start of the holiday season. The parade steps off from Ellsworth Drive in Fenton and proceeds south on George Avenue, ending at Silver Spring Avenue. We encourage families in attendance to socially distance themselves, wear masks to keep the community, our neighbors, and our young people healthy. It's wonderful to have this parade back this year, and I hope to see our residents enjoying this parade safely. Now I'm going to turn this over to Dr. Stoddard and Sean O'Donnell from HHS for their updates, and I look forward to your questions.
Sean, you can go ahead and give the numbers update if you'd like.
Okay, I'm just going to briefly share. Oh, I don't have access to share. Basically, what I wanted to do was cover from our pulse report, just some idea of what we're looking at with regard to boosters. I know there's some questions about that we'll get to shortly, but we have seen, in addition to the pediatric numbers that the county executive has shared with you, we have seen an increase in boosters over the last several weeks. This is encouraging because we continue to ask our residents who are at the most risk for COVID and COVID complications, which includes all of our populations over 65 years of age, to come and get a booster. So I just wanted to add on that we are also doing that. We do have an update on our latest numbers from COVID. Our case rate has been over 50 cases per 100,000 over the last week. We expect to have an update on mask mandates in the near future, but right now we are trending towards that occurring at midnight Friday, early Saturday morning, I believe. The rate over the past day was 8.28, which is, again, it's been north of 50 per 100,000 over the last week. Our test positivity rate remains very low, 1.65%, and that is a testament to the number of residents who are continuing to be tested when they're symptomatic, or if they are at high risk receiving asymptomatic testing. We are going to be vigilant at our testing sites at the county. We know that there's lots of private sector testing as well, and we anticipate that there will be some increased demand for this leading up to the upcoming holidays.
Are you done?
I am. I'm happy to add any additional numbers if you would like.
All righty, Dr. Stoddard.
Yeah, so thank you, Sean. So I just want to reiterate one thing the county executive said, and that is we certainly are, the Department of Health and Human Services is being very efficient in the distribution of the doses for children. We as the collective county received roughly 39,000 doses to the county, roughly 19,700 to distribute, which means that 50% of the doses that were received into the county through all the systems have not been distributed at this point. All of the doses that came to the Health and Human Services Department were distributed. So they are sitting in refrigerators in pharmacies and other locations, not having been distributed after week 1. We certainly, I want to make this, I'll make this bipartisan and say the federal government needs to do a better job of getting the state of Maryland more doses to distribute, number 1. And number 2, we certainly encourage the state of Maryland to look at who has doses sitting in refrigerators and shift doses from them, or certainly future doses not sent to them, but rather to partners that are distributing the doses, including HHS. But if there are other partners out there that have gotten all their doses out, we encourage them to receive doses as well in greater numbers, because obviously doses in refrigerators are not going to protect our 5 to 11-year-olds during Thanksgiving and the other winter holidays and the indoors times that we're be in over the next several weeks and months. And so we need to get shots in arms. There is certainly not a gap in want from the public at this point. There's certainly a mismatch that's occurring between who has doses and where there are opportunities to provide those doses. And we certainly would like to work with the state to the extent that we can to realign those. And certainly we need the federal government to work with Pfizer to provide more doses more quickly. So that's all I wanted to touch on today. And Dr. Kroll, I don't know if you have any opening comments, otherwise we can go.
Earl, I just wanted to add one more thing with relation to that. We did receive a notice yesterday that the state had moved up their deadline this week for ordering, and that was done to ensure that they could get the orders in to the manufacturers and the federal government early enough to get us doses early next week. So with that, we still need to maintain some of those 7,000 doses we received last week to ensure that we can do second doses. But we are doing a few clinics today with pediatric doses at school sites, and we're looking to do a few clinics this weekend as well. But we do have to hold on to most of those doses until we get a confirmation that enough second doses will be coming in.
But I think the key with what you said, Sean, is we have more capacity to put more doses out. We have more desire for people to receive them. We just do not have the vaccine to put out first doses in the quantity we would like to.
I think that's the only other thing I would add, Dr. Stoddard, was that it looks like we are. What this means, that translated boiled down, is that we're going to be doing fewer clinics in the next week or so, because we're now having to reserve doses to get prepared for second doses, to make sure we've got doses to give those folks who are now eligible, who hit the 21-day mark for second shots.
All right, thank you, gentlemen. Let's get started with the Q&A portion of this presentation. Kate Ryan, you're up first. Good afternoon, Kate.
Hey, thank you very much. I'll ask 3 questions right away so I can make room for other reporters. So number 1, it seems to me Montgomery County still has a sizable number of employees who have not reported their vaccine status. And I think we're a month from the deadline of when they were supposed to. What information are you getting from those employees? And those who have not or won't get vaccinated, my understanding was they are being tested or were to be tested. Are they, and how many tests have been conducted? And then lastly, are you concerned about your neighbor DC's decision to drop the mask mandate for indoors? And did you get a heads up on it?
Marc, do you want to start there? I'm happy to. It's up to you.
I guess we can kind of jump back and forth.
Okay.
You know, as far as DC's decision, that's their decision. It's obviously not the decision I would make over here. I think in the face of, you know, rising cases again, and the fact that people do get sick and there are breakthrough cases, and we're in the midst of trying to get our kids vaccinated, I think it would be premature for us to make that decision. But different people make different decisions. Obviously, we've been as protective as possible here. We've been flirting between moderate and substantial transmission. We'd like to get the transmission down as much as we can. The employee information, I'll let Dr. Stoddard take most of it, but I just want to start by saying I contacted the state because we had not been able to get any information on who was vaccinated from the state. And I had a conversation, and I was asked for help on one issue, and I reciprocated by asking for help on this issue. I asked them if they had a list of our employees, would they at least tell us the percentages of people who are vaccinated? They can't give us the individual information and identify which individuals are or are not vaccinated, but they were able to look at the entire range of our employees and give us a better sense of what percent of our employees are actually still unvaccinated. And that's our question about, the unreporting people. Without their report, we don't know who's vaccinated or not. So I guess, Dr. Stoddard, if you can kind of finish that off.
Yes. So Kate, we had, as you noted, we had about 11% of our county employees had not provided information about their vaccination status, whether they had been vaccinated or not. And as the county executive laid out, he talked to Steve Shue, who works with, he's now at the Department of Health and Human Services, or the Maryland Department of Health, as a deputy secretary, in concert working with the governor's office. And we got them to provide, we essentially provided them the names of our employees, and they, who had not currently provided a status, they screened against the CRISP system, which is the Chesapeake Regional. It's the information sharing portal that keeps track of vaccinations. While they wouldn't provide us names of employees who had been vaccinated, they would give us, of the people on our list, what percentage of people on that list appeared in the state database as having been fully or partially vaccinated. And we're happy to report, and the system will be updated today. We actually got this information this morning. So the system will be updated later today to reflect this, that roughly 50% of the 11% of employees who had not provided their information have been fully or are partially vaccinated, which will mean that our 81%, I think, currently reflected partial or full vaccination rate will go up to 86% or something around that number later today once the system is more fully updated. And then obviously we don't know the 50% who don't appear in the state system, whether they could have been possibly vaccinated in Pennsylvania, Virginia, DC. We just wouldn't know. We just know affirmatively which ones appear in the state system. And so obviously we're going to continue to work with employees to provide their status. I will note, so we did start, we're rolling out employee testing. We started doing employee testing with the fire department on Halloween, actually. So they've been doing for about 2 weeks now. We have reached an agreement with GEO, which is our largest employee union, covers the majority of county workers for testing. We reached that agreement. Actually, it was signed earlier today as well. And so we're going to start launching employee testing with the largest employee pool on Monday. And then obviously we're still working through a few details with our police department, our FOP Lodge 35, and expect to have an agreement with them shortly, hopefully by the end of this week. So we can start with them next week. The only other thing I would note too is that obviously we're paying very close attention to the new OSHA requirement, which states that you must test employees on a weekly basis. That takes effect, I believe, on January 5th of next year. But the other thing about that is it does require masks to be worn for unvaccinated employees beginning on, I believe, December the 5th. So we've got like 3 weeks before that would take effect too. So we're working through those details as well. And so there will be some changes. Furthermore, the last thing I will note is we're actually doing some outreach specifically to targeted areas within county government, doing some education where we're going to bring a doctor and have a special session where we meet with certain pools of employees. Our DOT bus drivers are one example that I will provide, where we're going to meet and talk through some of their concerns, try and dispel rumors or misunderstandings about the vaccination to try and encourage people to get vaccinated and move them towards that process as well. And so all in all, I think, 86% of county employees roughly having been full or partially vaccinated is a really good number. It's actually pretty reflective of our population. And frankly, it meets the 85% threshold that the county council has established for the suspension of the mask order. So, obviously it's a good number that was used for that purpose. And we feel it's a pretty good number to be at for our employees. There are certainly a lot of states in the country that would kill for an 86% vaccination rate. And so we're pretty happy and pretty comfortable with where we're at. We're going to continue to try and work to get more employees vaccinated, but that's the update for where we're at.
Thank you. And one last question, I apologize real quick. The way we report substantial, this business of having to take Montgomery County numbers and send them to the CDC, we get this 30-hour lag. Is there any way to do away with the 30-hour lag? Why is that? Because as far as we can tell, and my partner here, Jack Moore, who is much more data savvy than I am, has found that every single time the numbers match up precisely. It's not like the CDC uncovers, oops, Montgomery County, you didn't count it right.
Yeah, so there have been cases. You're certainly correct that in the last month or so, every number has been 1 for 1. I have seen in the kit past, there have been instances where it's been off by a case or two. I'm not sure whether that was just a reporting error or whether, what happened in those cases. That said, you're generally correct. What our numbers as we report them today, for example, will show up tomorrow at 3 p.m. or so on the CDC website. Now, obviously, the CDC is updating for 50 countries plus a number of territories, that they have to account for, who all are in different time zones, have different reporting structures, have different reporting systems, and so they're a data aggregator, and so they're going to always be lagged. Now, certainly the question really around how it applies to the mask mandate and other Board of Health regulations is really at the discretion of the Board of Health. In this case, they have prescribed via regulation that we will utilize the CDC numbers. Candidly, I think it's largely because the CDC has that lag, and it gives more time to be sure about things. But certainly, it's sort of it's a little bit of semantics about which system you use, because as you noted, they're largely the same.
Thank you very much.
All right, thank you so much, Kate. Coming up, Corey Smith, NBC4. Good afternoon, Corey.
Good afternoon. Yeah.
There you are.
Good afternoon, everybody. Question, just a couple real quick questions. In terms of, the county executive said the numbers are going the wrong way. In terms of the cases that we have seen move Montgomery County back into that substantial category, are those cases being driven by the unvaccinated? And then secondly, obviously, the county executive talked about the DC taking its approach compared to the counties. I just wanted to ask his response to something that the mayor said this week in terms of their kind of shift from public messaging, calling, saying the COVID-19 pandemic is shifting to an endemic, and we've got to learn to live with this, knowing that folks are getting vaccinated, knowing that kids are getting vaccinated. Can you say at this point when Montgomery County may shift to that kind of recognition that this is endemic and no longer a pandemic? And is there a concern that you move too fast, especially with the holiday season coming up? And that'll be it.
From my personal opinion, that, with the holiday season coming up, and not just the holidays, they're getting colder, so that everything becomes an indoor activity. I do think it's premature, and I would feel a lot better about this if we had our kids vaccinated. Once we get to 85% of our kids vaccinated, I think we're in a lot better place. But I don't think we're in the place where we should be letting up. I would continue to say that, we have erred on the side of safety. Being safer has led in, generally lower case rates in the county. It works. I don't know why we'd want to change it until we get this last tranche of children as fully vaccinated as possible.
The only thing I would add is, when we were with the Board of Health last week, when they were considering, or maybe it was, I'm not sure, it was 2 weeks ago. Time moves quickly sometimes. We talked about, having a reevaluation of where we're at towards the end of December, or maybe early January, something along those lines. Because I think the county executive has exactly said it right, which is we're looking to get this last big phase of young people vaccinated. Once we get that, I think what DC, I think there will be a national debate around when you decide it's endemic. I think our stance in the county executive's position certainly is, and it's a reasonable one, is that we vaccinate this last phase, see where we're at, and then that certainly we're going to have to all move to an endemic management of the pandemic / endemic disease. How are you going to call that? I do think it's important, though. We have school age students who, are still going into a shared classroom, and obviously, we're working very closely with MCPS to keep those safe. But I think that when we talked about putting the mask mandate back in July, we talked largely about the fact that we were trying to protect the school environments and keep them to be as successful and keep as many kids in the classroom as possible. And I still think that's the position where we're at until the younger people get vaccinated. And then I think we're having a much different conversation about how we manage this. And it won't be go from no mask or mask to no masks in every setting. It may be more targeted once we get this next pool vaccinated, that we have to think more about, where maybe it's, obviously we all have childcare settings and, maybe still nursing homes, other places where there are high risk patients, things like that, I think is where everyone's going to have to eventually move. But it's a question of when you decide to move there and under what circumstances. I think our view has largely been, we're in the midst of vaccinating this 5 to 11 population. That will move pretty quickly if we're given the doses as we described. Let's finish that job and then have that conversation.
Another question. Sorry, go ahead, Dr. Crown.
Just an observation that the pandemic does refer to a state of the infection across multiple countries and multiple areas of the world, not just a region. So we are, by definition, still in a pandemic because it is a global phenomenon, as you know. The shift to endemic will be a medical shift when it starts to be more regionalized and more routinized in the way the flu can be. So we are not there yet, and so we do need to continue to stay on a safe course and continue to get, as Dr. Stoddard points out, our youngest population vaccinated, and continue to be cautious until these numbers drop to a much lower level than they are now.
Am I cases questions, or is that being driven by the unvaccinated still?
We have to look at the pulse report. That certainly. What the numbers had been, and I actually am looking at the last pulse report. I don't know if we have the one. I don't have the most recent one. Sean, maybe you can provide this update. But generally speaking, about half the cases have been coming from the unvaccinated, which in a population where 90% of the people are vaccinated and half of them are coming from the final 10 to 12 or 15%, whatever it is, that tells you a lot about the rates being so vastly different. But Sean, you can provide probably more information than I can.
No, you're accurate. It has been that in the latest report, just looking at 12 and above, just the population's 12 and above, where we have 8% of our population that's not fully vaccinated, they make up 56% of our cases, and they make up 65% of our hospitalizations. So certainly if we could remove 56% of our cases, by having those folks vaccinated, we certainly have lower case rates if we had everyone fully vaccinated. That the data is pretty clear about that. We'd still have some breakthrough cases. I think there's good questions about how much more infectious an unvaccinated individual is versus a fully vaccinated person, and how that affects the whole chain. But just removing the cases with our small but unvaccinated population would have a significant effect on the number of cases in the county.
I just want to add to that the truth is that it's the unvaccinated cases that are responsible for the vaccinated cases. I mean, if I was among a totally vaccinated population where there were no cases in it, there would be no additional cases. It requires the exposure to cases. And very few people in the vaccinated population are getting COVID. As you pointed out, the number of people who are vaccinated is around 900,000 people. And you're looking at, half of, 100 people. So the number of people who are getting it, you got to imagine that the primary source of their cases are the unvaccinated. The other thing that, I don't know if Dr. Stoddard wants to elaborate, but the other Delta variant, which I think I'd alluded to a week or two ago, it has now arrived on, the Eastern Shore? And this apparently is a yet more infectious version of the little demon that's running around. So that's a concern, because anything on the Eastern Shore isn't going to stay on the Eastern Shore, just like it didn't stay in the northern states where they were initially reporting it. So that's another thing we have to contend with in the winter season, when we're all coming inside, the possibility of yet a more infectious version of this thing.
So I think, the county executive is referring to Delta 4.2, which is a subvariant that most notably was driving a lot of the increases we've seen in the United Kingdom. And I believe what Dr. Bridger said earlier is actually it's more prevalent in the East Coast. So I think it's actually prevalent throughout the state of Maryland already, but it's a bit more infectious than even the base Delta strain. It's just, it's a reflection of the fact that the pandemic is not done with us, even if we're done with it. And I think that's the thing that we need to keep vigilant about. Now, it's not all about, what we've talked about a lot is how having to manage this. And frankly, my view, and I think the view of the county executives, is that the use of face coverings is not an onerous restriction on the way life can be lived. I know that some people don't like them. I don't particularly like them. I won't, I don't find them enjoyable to wear, but I realize that my responsibility to protect my community exceeds the, necessity. And I've heard a lot of people say they're not 100% barrier to infection. They're a part of a Swiss cheese model of minimizing the spread of COVID. And if they're 20% effective or 30% effective or 50%, depending on, whatever the mask quality and kind you wear, they're varying. That still matters when we think about population-based health. A reduction is a reduction. And when you magnify that reduction over across a million people, that reduction magnifies itself versus the protection of any individual within that 1 million population. And when we think about public health, we're not thinking exclusively about the health of the individual, we're thinking about the health of the population. And use of face coverings can reduce the overall risk to a community. Now, we're all going to have the debate about when we move to an endemic management of the disease and what that entails. But I think that, we are actively in the midst of vaccinating our 5 to 11-year-olds. Let's finish that job.
All right, thank you very much. Thank you, Corey. Next up is Brian Sears, a Daily Record. Remember, reporters, we have a 1:30 hard stop. Let's get moving.
This question's for Dr. Stoddard or the health department team. The state health officials earlier this week told a Senate committee that they were wrestling with the question of going out on their own against CDC guidelines and starting to offer boosters to adults 18 and over. At least one county says that they are already doing that based on a wider definition of risk. My question in general is, are we at a point now where Maryland should be offering those boosters to anyone 18 and over who are 6 months out from their last Moderna or Pfizer shot? And what is Montgomery County's policy? Is the county already doing that?
Dr. Crowell, you want to chime in first? I certainly have an opinion. I'm happy to share it, but I don't want to get out of it.
I think that we'll just have to wait and see what the state does around this. We are not in the county stepping out on that and vaccinating 18 plus that don't meet the high risk categories. However, I will say we are very much in a self-attestation mode around this. We are not seeking a lot of information to verify the health status of folks who say they are in high risk categories. So it is highly likely that there are some folks who are in a broader, who more broadly defined high risk categories that are getting vaccinated at this point. I think it's a matter of time, and the sooner we do it, the faster we'll be able to get the rest of our population into the boosters.
I think that's where I'm at. So good, Sean. Good.
I was just going to add, we do get questions from county and private sector individuals whose occupations don't clearly fit the list of occupations that the CDC has presented, and they ask if they would be considered a high risk occupation. And we go with, and the CDC actually includes this in their guidance. If you are in an occupation that puts you in frequent contact with the public who may not be vaccinated, then you would qualify for high risk, even if it's not a list of the existing occupations. That's not an exhaustive list. So we do let individuals make that own determination based on that further guidance.
Last thing I'll say, and I'll give you the quotable, I guess, is certainly we're not out there on our own. We wouldn't go out there on our own doing something different from what the state has said. But I'll come out and say, yes, the state should move to that policy as other states have. We have an issue of waning immunity throughout the population. We have prioritized, rightly so, the older population for boosters. And we continue to do that. But if you have been to a booster clinic anywhere in Montgomery County, there is no line at this point. There is no glut of people still waiting for the boosters. And so I would certainly encourage the state to do as other states have done and move forward, even absent a CDC recommendation. But the data was pretty clear that there is waning immunity across the country. There's no question about that. as Maryland was one of the first and earliest and most aggressive vaccinators, we have a longer attenuation period or a longer period between our second doses in many cases. And Montgomery County is right at the forefront of that list. And so we have a population that is moving very quickly through that 6-month phase. And certainly I would encourage the state to take very seriously that consideration, as certainly New York announced, I believe, yesterday. And, for reducing COVID-19 will inherently protect our unvaccinated populations, our immunocompromised populations as well. And so certainly we can do what we can do to provide those boosters. And I think that, frankly, I think the CDC and FDA are going to move there anyway. But as the months get cooler and we get closer to holiday seasons, I think it will be important for us to get a head start on that as quickly as possible.
Thank you, Dr. Stoddard. Thank you, Brian. Next up, Steve Bonnell, Bethesda Beat. Good afternoon, Steve.
Afternoon, everyone. This stat that Elrich shared, I think, jumps out at me. So my understanding is you guys are getting a third of the doses for 5 to 11-year-olds from the state, yet as of this chart through today, you're responsible for 61% of the doses that have been administered. What are you hearing from the private sector about, like you said, there's demand here. What's the holdup from the private sector? What are you hearing if you're having those conversations?
Look, the private sector is motivated by something different than we are. I mean, none of the health clinics, the pharmacies don't have a campaign to go out and get people vaccinated or targeting populations that are especially in need. They're waiting for customers to come through the door and go there. Our mission is getting these things out the door to people who need them as quickly as possible. We just have very different motivators, which is why I firmly believe more of the doses ought to be going to us, because we will actively work to put those doses out. I'm not waiting for a customer to come through my door and go shopping and think, oh, by the way, I think I'll stop and get a vaccine. I know where the people are. We know where the kids are. We just need the doses to get to the kids.
And I think you said that some of the next 2 weeks that we might not get any doses from the state. Does that concern everyone, 21 days after they get their first shot? Are you concerned about the logistics of supply and whatnot? I know you mentioned, there's a debate about whether the current doses should be shifted around, but that jumped out at me as well.
We are not getting enough doses to do what we need to do. There's no question about that. I think there's no other way we can say that. So are we concerned? We're concerned that the pace is not moving the way that we are capable of having it move. The bottleneck is in delivery of doses to us, not in our ability to distribute them. That's the key message here. And so we're on the, we get a lot of the pressure saying, why aren't there more clinics? Why aren't you doing more in this area? Why aren't you, providing more doses in this community? We don't have enough doses to cover all the communities that have this great need, which is, I want to make sure that we're being clear here. I'm not sticking this exclusively, not even majority on the state. This is a federal Pfizer issue that is driving the challenges that we face at the local level. Now, it could be made a whole lot better by the state being more intentional about where they release the doses that state does receive, and making sure that there are shorter timelines when those recipients have to distribute them. But again, I think the biggest bottleneck is in how much vaccine the state of Maryland is receiving, and then having to subdivide to us and the other counties and other providers. I think their effort to provide a multitude of different avenues for people to access vaccine is laudable. It's appropriate, but they have to hold the people who receive vaccine accountable for getting the vaccine out, and getting the vaccine out in an equitable manner, not just through an unintentional, passive process.
So the other thing I would just to clarify that we did not say we would not get doses next week, but that the numbers of doses that are coming are lower than we would like to see. Certainly lower than our capacity to put doses out. The other thing is that we made a decision early at the start of this process that we would vaccinate as many people as we could rather than try to reserve doses for second doses down the path. Not clear that other providers have made that same decision in the private sector or in the pharmacies. So it may be that they are vaccinating at a much lower rate because they are holding doses back. But even with that, I don't think it accounts for the different discrepancy between what we have been able to put out as a county and what the other providers have been able to put out.
And how much lower is that than you expect, roughly, if anyone knows, per week?
Well, I think our first shot at this tranche, this was 13,000 doses, if I'm not mistaken, Sean. And then the past week we received 7,000, and I think that's projected for the next round, perhaps as well.
I believe the state received 180,000 for the first round, and I believe it was something like 88,000 for the second round. So that shows you the cut the state received in terms of their total doses, and that's been largely reflected down through most apparatus for that reduction.
All right, thank you, everyone.
All right, thank you, everybody. We have about 5 minutes left for reporters that want to ask questions. So let's see if we can get to all of them. Thank you, Steve. Tim Carney, Washington Examiner, you're up next. Take about a minute, please.
Thank you. The current way of going to the mask mandate basically allows a high case count alone or a substantial case count alone to trigger a mask mandate. Part of Muriel Bowser's comments was that you needed to have a broader look. And this county, thanks to your guys' great work, has immense vaccination rate, has 1.6% positivity, which means our barely substantial case count is a result of huge testing, which again, the county is doing a great job on that. Hospitalization is low and it never reached substantial during the initial Delta surge. You throw in the upcoming pills from Merck and Pfizer, which dramatically reduce the risk of hospitalization and death. So if we're allowing case counts to determine our policy, are we fighting with the wrong tactics, considering how good the vaccines and these upcoming drugs are at preventing the worst outcomes? Should we be looking at the worst outcomes in vaccination rates and not just case counts?
All righty, who's taking that quickly?
Dr. Stoddard.
Yeah, I'm happy to start. So I don't think there's a disagreement about the position you're taking that you've described, which is that we need to be integrating more. It's just when and how we integrate more. And I think when we spoke to the county council as they were sitting in the Board of Health thinking about this regulation, I think we largely talked about the fact that we're in this last phase of last big phase, I should say, of vaccination. There's still going to be 4 and under, and going into the holiday season. So it's a timing question. I don't think we fundamentally disagree with what Mayor Bowser has said. It's just we've chosen to be a bit more cautious from the perspective of we've got this last phase that we're vaccinating. We've covered, I think the state has covered 13.29% of the 5 to 11-year-olds with 1 dose. So we're quickly moving through that group, and we will move to a phase that you describe. It's just we just don't believe we're there yet. We want to move there consistent with this last population receiving more vaccine. But again, I think that overall, what you're going to see across the country is there's going to be different comfort levels with when you've reached that endemic management phase. We just, I guess, don't agree that we've reached it yet until we finish this last 5 to 11 population vaccination. But again, what DC is doing with integrating more hospitalization data and other things is exactly what we'll likely do once we have a few more of the 5 to 11-year-olds fully vaccinated. I would just note that looking at the data we talked about with Vermont, 80% of the hospitalizations are driven by the unvaccinated. Well, amongst the 14 hospitals in Vermont, there were 11 ICU beds as of yesterday morning. So you could still have a significant surge with Delta from a very small population of unvaccinated people. And not that I expect that we're going to see that, but it's just enough of a reason to finish out this phase of vaccination before we make a major substantial change. Do I think it's going to make a huge difference to keep masks on at this point? I don't know. I don't think so. But I certainly, there's enough reason to do it, and there's a little harm to doing it to justify continuing the policy.
I'll just add that, continuing to look at not just data, but discussions in the scientific community about long COVID, we get so fixated on how many people in an ICU and how many deaths there are. We also have the kind of like the undiscussed problem of people getting long COVID and long-term health effects from COVID. And also among young children. I read an article yesterday about, large number of cases in children with long COVID. So it's, if we only focus on, deaths and ICU use, and don't think about what is the impact on somebody who maybe gets COVID, doesn't die, but gets sick and then suffers from long-term effects. Those are real things that we need to take into consideration. It's not like for a lot of people, they're going to have this and just simply get over it and go back to normal. And so, in my view, you want to minimize the damage done to people in the community to the greatest extent you can. I consider masks to be like a small, insignificant price for doing that. If we were talking about bouncing back and forth between closures, and opening, I would get the frustration and I would say, yeah, this is, we need a more consistent policy. But if you're only talking about wearing masks and I can go anywhere I want with my mask on and see any show, go to a movie, do whatever I need to do, to me, this is a trivial issue in the larger scheme of things.
All right, Mr. County Executive, we do know that you have to go. Literally, you have to transport yourself to another venue, another location, to another event. The rest of the participants, Sean, Dr. Stoddard, and Director Pearl, you can stay to answer the few questions we have left, correct? All right, wonderful. Thank you, Tim. Next up is Kevin Lewis, ABC 7. Good afternoon, Kevin.
I'm on the unlucky side of 1:30, so I'll send my executive questions to his office. But Dr. Stoddard, I think you would be probably best suited for this. With the 81% figure of county employees that have reported being at least partially vaxxed, and if you're able to extend it to the 50% or so of the 11% you were talking about today, what percent of that figure are fully vaxxed versus partially vaxxed? And I asked because the county council's bill as it stands, and as I understand it, calls for full vaccination status.
Yeah, so the number of the partially vaccinated number is very small, and I will say it's something like 1 or 2% of that number. So we're talking, 79% fully vaccinated, 81%, and if we get that 5%, I think it's a similar. But I will also tell you, one thing that we found with implementing the fire rescue training, the testing program, is that a lot of people didn't realize they had to go back in and reestablish their status. So we notified people who were partially vaccinated to say, hey, you need to be part of the testing program until you're fully vaccinated. Like, oh, I've been fully vaccinated for 3 weeks. Here's my information. So I expect as we roll out testing in the other programs starting early next week, we're going to see people coming back in who didn't realize they need to come in and update their partially vaccinated status. So I think that number will shrink even from the 1 to 2% of partially vaccinated that we have. So.
Okay, and the 11% figure, are many of these individuals, as you said, and I had heard that as well through the grapevine, they were unaware that they had to still report because they got their vaccine from the county and assumed the county had those records. But has there been education that has led to buy-in? And if so, roughly speaking, are we talking like a few dozen, hundreds?
So I actually just had the number. Let me pull it back up. So over the last month, we've had 900, or let me get this correct. Over the last month, we've had 839 additional new reports. And that's not including this crisp number that this dump that we're getting today. So over the last month, we got 839 more people to report, and of those, 773 were fully vaccinated. So 92% of the people who've reported are actually fully vaccinated. So we're seeing people come in 10, 15, 20 a day. And the big thing that we saw is when we implemented the fire rescue testing program, we actually saw a 27% reduction in their unreported number over about a 10-day period from the time that we started the event. Because then people realized, okay, there's going to be a consequence to my not having reported. I'm going to come forward and report. So we expect the unreported number will go down more next week. We also know anecdotally there are a number, I don't know what the number exactly is, I've heard this from fire rescue, there are a number of people who, once they heard the testing program was started, they actually did get vaccinated and are now just waiting for their second dose to be fully vaccinated to cease their testing program. So we know people are coming forward to report. They have been progressively doing that since we've launched the reporting program system. And I would expect that will only increase with the implementation of testing again, which began with fire rescue, and now will continue with the other two employee groups.
Is it your sense that the county council's kind of remaining in a holding pattern with this bill until some of these wrinkles can be ironed out?
They've asked for Council Vice President Albornoz and Council Member Navarro, the chair of the Government Operations and the HHS committee, are having a subcommittee hearing next week on the 22nd, have asked for an update on our testing program, because I do think that they are looking very closely at the vaccine mandate policy and have seen the challenges that have arisen in various other settings, what happened in New York City, what happened in, even what's happening now with MCPS, what's happening in other settings with mandates and what it can do to organizations. So I think they're paying close attention and looking at what their alternatives are with regard to the new OSHA standard, other things that could be done. So I don't think I think they're sort of weighing what the alternatives could be as opposed to implementing a mandate. And I think that they're doing their due diligence, which is what we've encouraged them to do. So I don't know where they're going to come down that. They haven't, I haven't tried to assess where votes are on the mandate. But I think that's part of the process. They've asked a lot of questions about testing.
All right, my second topic and the only other one. Last week, there were some questions about social workers in schools, and at the beginning of the school year, Interim Superintendent McKnight had stated her intent to hire around 50 new social workers to help students at this time. Has there been any more clarity, and perhaps if Dr. Crowell's still on the call here, any more clarity as to where that hiring process stands?
So I can tell you that they are in the process of recruiting and sorting out quite how they're going to go about doing that. I mentioned, I think maybe a few weeks ago at one of our council sessions, that across the region and across the country, there is a shortage of social workers to be hired at this point. So I think they are certainly encountering that as well as we are in terms of just being able to staff up appropriately. I do know that they are. We've been talking with them about ways and strategies in which we might cooperate and collaborate in trying to identify staff that can come on and do some of the work. The other piece of this is that in our conversations with MCPS is that we use the term social work in a very generic kind of way to mean somebody who helps other people. But in the field, it is often referred to as a licensed clinical social worker. Not everything that we need to have done in the schools and the community requires a licensed clinical social worker with a social work degree. There are a variety of different kinds of professions that can be hired to fill that kind of helping role that MCPS needs and that we need. So we're working with them to help them identify what other professions there are that can be recruited into those roles, and where there might be opportunities for folks with bachelor's degrees or other educational levels to step in and fill some of the roles of support that are needed in the school system.
So as we report this, is the most accurate way to report where this stands is that there haven't been any hires of that reaching that 50 goal, but the work is underway, and part of the challenge is just a limited supply of the loose term, which I can agree, of social worker at this time?
I can't confirm they're hiring or not. That's something for the MCPS would have to support. I don't know where they are in terms of the numbers, but I would say that the supply is certainly going to be an issue.
All right, thank you very much. Appreciate it.
Thank you, Kevin. Next up is Justin Hinton, also ABC7. Good afternoon, Justin.
Hello. Yes, my question was for County Exec Elrich, so I'll just send it to his folks. I didn't want to hop off and not be here to tell you that. So thank you, though.
Okay, thank you so much, Justin. And next up is Corinne Carlton, the C2 Project. Good afternoon, Corinne.
Hi, good afternoon. First, I actually just want to mention that some states are actually taking OSHA to task, by the way. So now that I've gotten that off my chest, DC, I have 3 questions. DC has a home test kit available to residents. Will Montgomery County have a similar program in place? Also, are there plans in Montgomery County to make vaccination mandatory for kids under 12? And my other question is, as vaccination is not foolproof considering the school schedule, what proactive plans are in place in case of another outbreak?
So the first question there was something, I think you were talking about the Test Yourself program that DC has in libraries. Is that
Yes.
what you're referring to?
Mm-hmm.
So certainly we've been looking at, we looked at that model. We're certainly talking about it. We're not ready to announce any sort of launch for that or launch, progression towards that. But I will tell you, we are actively looking at a couple different ways to enhance, modify, make more available testing. And one area that we'd like to also make more available is rapid testing. As we've talked about, we've ordered a bunch of rapid testing kits and would like to make them available publicly through a mechanism, but nothing to announce today, but we're certainly looking at it and hopefully going to move in that direction soon. Sorry, I know there was a question about school-based.
If there are any plans in Montgomery County to make vaccination mandatory for kids under 12?
Certainly not from the county perspective. You'd have to ask the school system what their position was. My sense, though, is that they would defer to the state to make a determination about any policy of making vaccine mandatory. The state generally sets policies for which vaccines are mandatory in school settings. And so I think they wouldn't want to get ahead of any process that the state would normally implement. But that's just me speculating based on my understanding of their position. You certainly would have to get them to comment on it. We have not had a conversation at the county level in terms of county HHS that I'm aware of to try and mandate vaccines.
Okay, and the last question was understanding that nothing is foolproof, the vaccines aren't. If considering the school schedule, are there any proactive plans in place to, in case of another outbreak?
Yeah, so we're working with MCPS closely. We're at this point meeting with them on a weekly basis to go through and look for enhancements. Obviously we've made changes to the quarantining policy. We've encouraged more enrollment. Through that change, we've actually encouraged more enrollment in the screening testing program. Masks are required in schools and will likely be for some time based on the state Board of Education's ruling. I think they're not evaluating that until December again, but I could be wrong about that. And then obviously we're working very closely with them as part of the contact tracing process to identify and inform and get screening for those students who are identified as close contacts to really try and curb any outbreaks that might occur in the school settings. And so it's sort of an ongoing layered process that we're working very closely with them to enhance on a regular basis. And I think we've talked about, other measures that we could implement or looking to implement in the school setting to try and do more testing, more identification of close contacts, and keep kids in school to the maximum extent possible, but also make sure that they're safe in doing so.
Okay, thank you.
Thank you, Corinne. Thank you, everybody, for participating. We do not have any more questions from the members of the media. So good afternoon to all of you. Stay safe, and we'll see you again soon. Take care.
Thank you. Bye-bye.